Hello, good evening, namaskar to all the viewers of this Fogsi Presidential Initiative Gyan Pravah podcast series, which is live at 8 p.m. every day. And today being 20th of October, it happens to be Diwali. So I wish all the viewers a very happy Diwali. And today we also celebrate episode 265 of this podcast series. And for this, we must congratulate the Foxy and congratulate Dr. Sunita Tandulwadkar, madam, for this visionary initiative, which has happened for the first time ever in Foxy. And today, I'm really humbled and honored to welcome our President, Dr. Sunita Tandulwadkar, who is a beautiful soul, multitasking, multi-talented, the dynamic, energetic president who is committed to women's health all the time. Welcome, madam. And I'm also honored to welcome today Dr. Jyoti Singh, the consultant at Grand University Hospital, UK. She has also done a lot of work in women's health. So welcome, Jyoti. Today we'll have an engaging discussion about your global journey in women's health. But Sunita, madam, actually Jyoti is my batchmate. And when I was just talking about her, talking about you to her, she said she already watches all the podcasts and she's already so much overwhelmed by your visionary leadership, your academic brilliance, and the kind of work, the volume of work you are doing. She is already knowing about this because I share my podcast in my batchmate group. But let me formally introduce our Foxy president.
Don't. It is you, Archana, you and Jyotiji's day tonight. So don't introduce me.
Just for the, I think for the viewers in UK, although I know the UK people also know you a lot because recently you worked for Sampurna, the project we are doing on preconception, health of the women and optimizing women's health as a holistic approach is already acknowledged. And Jyoti, we must congratulate Madam once again for being acknowledged by RCOG. She has been awarded fellowship, honorary fellowship by RCOG, and recently her work on Sampurna was acknowledged by FIGO also. So we are so proud of her. She makes all the Foxians so
Hearty congratulations. It's not easy to get this.
Thank you.
That's what. And she is about her multi-talented abilities. Jyoti, let me tell you, she is not only a profoundly skilled endoscopic surgeon. She is into fertility. She is into high-risk obstetrics. She is into regenerative medicine. She has the credit of having India's first stem cell baby and so many accolades. And the kind of social and academic projects she is doing, I already told you about Sampurna, but there are the other projects, Mukta, which is about thalassemia eradication, Do Tike Zindagi Ke is about prevention of cervical cancer, and then Know Your Number is something which is again a brilliant idea of her, where every woman should know the 4 cardinal number, BP, weight, sugar, and hemoglobin. So the kind of leadership she is doing is exemplary. And we are profoundly grateful to her for all the opportunities and the kind of work she's doing. It is truly inspiring.
Archana,
so I welcome
you are
you,
making me feel little awkward now. Thank you so much, Archana. I know we both have a love for each other, and thank you for your kind and generous word. But Jyoti, it is today the day where Archana will be interacting with you and we will listen to what you have achieved, what you are doing in maternal health. I so appreciate on this auspicious day and sitting in a different country, early morning time zone for you. But you are there, and anyone coming on a Foxy platform, I join just to welcome them and show the honor and respect for your time and what you have achieved in life. So thank you for being on there. And Archana, you are my most dependable chairperson. You do amazing work. The committee, whichever you have, but you work in whatever responsibility we give you. You come out with the brilliant ideas, and I'm thankful to you. You are a very passionate and silent worker, Archana.
Thank you, ma'am. Thank you. It's all because of inspiration from you.
No, you are too good, Archana. You should know about it. And thank you for having this podcast. And thank you for having Jyoti. Jyoti, our pattern is only two of you will be in the framework. And I'll join the viewers link to hear both of you and to watch both of you. Thank you. Thank you for here.
Thank you very much. I would just like to say a few words before we start, and that is thank you for your time today, and of course, Archana's hard work. I have been learning about you, and I truly appreciate the work that you have been doing. India needs such a kind of work, and I'm very impressed with your work. And we can go ahead now.
Thank you. Thank you. Bye, everybody.
Thank you, ma'am. Thank you for joining. So it's now my honor to introduce the guest speaker for today, Dr. Jyoti Singh. She is MRCOG, MRCPI, and FICOG. Is an accomplished consultant in obstetrics and gynecology, currently serving at the Grant University Hospital, UK. She brings a very rich global experience, having worked across Tamil Nadu tea plantation in India, the Middle East, and now in the United Kingdom. She is a UK national level representative of UK Audit and Research Collaborative in Ops and Gynae. Dr. Singh has a specialized training in advanced labor ward practice, complex early pregnancy, and acute gynecology. She is an accredited colposcopist from British Society of Colposcopy and Cancer Prevention, and a certified laparoscopic and robotic surgeon under European Society of Gynec Endoscopy. Dr. Jyoti has authored so many publications and indexed journal, and has been actively involved in professional bodies like BSGE, ESGE, and so many, including ICOG. In India, she previously served as the president of IMA Anomalies for 3 consecutive years, and worked passionately for the welfare of women employed in tea plantation of Tamil Nadu. Her efforts earned her the Tamil Nadu State Award for Occupational Health from Indian Association of Occupational Health. She received a Best Paper Award at RSSDI World Congress, and was recognized as Best All India NCC Cadet during her medical college years. I remember those days, Jyoti. So you exemplify excellence in clinical expertise, leadership, and social commitment towards women health and well-being. So I welcome you. And today we are going to have a very engaging discussion about your journey, your global journey, I can say, in women's health. So to start with, let me ask you, could you just take us through your journey from medical training in India to your current role in UK?
Yeah, of course, Archana. Thank you very much for your kind introduction. And it was a little overwhelming for me, I think. But yeah, now we can start with answers. So my global journey has been quite an exciting one, quite a difficult one sometimes. So I did graduate from and did my post-graduation from PMCH, after which I worked a little bit in Calcutta.
Patna Medical.
Yeah, Patna Medical College Hospital. And then I did a little bit of work in Calcutta, and then moved to the south, where I had this unique opportunity of working in tea plantation hospital, which was unique in the sense that in there, you don't just prescribe medicines and do surgeries and look after patients, but you have a very holistic approach, in the sense that we also had to look after their working conditions, safe water supply, safe housing, and health and hygiene of the creches where the up to 5-year-olds were kept. So this gave me a very unique experience. And also I was the IMA president at that time, local IMA president, which gave me a lot of platform to work towards their health and well-being. It was a very satisfying role, and the place was beautiful. However, I had to move on. So I then went to Middle East for a short while, where there was a rich working experience, but I was looking for more than that. And I was basically also trying to earn money to give my exams in the UK so that I could come here. And then I moved to the UK, and I have here grown professionally and personally, I would say. And here I am. That is my journey.
So thank you for just having that was just a brief and crisp idea about your global journey. But let me ask you that what actually motivated you to take about early pregnancy care and obstetrics on one side and being a minimal invasive surgery also?
Yeah, so initially, labor ward was my priority because that is given a lot of importance in the UK. It is a very challenging area where we do high-risk obstetrics, a lot of things in the labor ward. It gives you a chance, if you do advanced labor ward practice, it gives you a chance to sort of be involved in reducing the mortality, morbidity in women and infants. And I thought it was a good opportunity to do this, as I already had the skills by the time I reached UK. I only had to formalize it. So I felt interested in this and then did advanced labor ward, which was not easy, but yeah, it was done. And then early pregnancy was an interest.
Obstetrics is always a distress, not only for the mother, for baby, but also for obstetrician. You are
Yeah, very true.
24/7 on duty. So nowadays, many younger generations are not taking obstetrics for this reason only. They are opting for endoscopy, fetal medicine, which is kind of a 9 to 5 job for them. But obstetrics is truly challenging and inspiring too. I agree with you.
Yeah, it is very rewarding as an area, but it also has its challenges. And as you said, here the younger generation here are also not taking up too much of obstetrics.
Yeah, it's there in UK also.
Yes, definitely. There are not too many people are taking obstetrics nowadays. However, I was quite interested because I like challenges in a way, and so I took this. Also, for the early pregnancy, I was interested only because early pregnancy is a very touch-me-not area in the UK, in the sense that you'll not be allowed to scan unless you have a formal training in early pregnancy. I already had the skills of scanning, so I thought I would formalize this as well. And that is how. And also, this is an area which is a very sensitive area where you need a lot of, even in labor ward, another thing which attracted me was because it is an area where you need a lot of leadership, team working, communication. So, and I wanted to sort of be perfect in that. So, these were the reasons for doing all this. Minimally invasive was a growing area, and I was sort of trying to make myself more versatile by taking up minimal invasive, and because we were not trained in minimally invasive previously, so it was like area which I wanted to explore.
Yeah, that's true. So what have been the most defining professional and personal transition for you from India, Middle East to UK?
Yeah, I mean, there have been many, but I would just say a little bit about it. So I think personally, I have become more sort of open, like I express my opinions more, and I have become more aware of the surroundings, more aware of what people would like or dislike, and of course, in the UK, saying much more of thank yous and sorries. So those were personal things. Professionally, I think I have become more mature, as anybody would in their career. But now I do more of evidence-based practice and keeping always think of the patient of the patient's safety as my utmost priority. And also think always how like the patient will feel if I say this, whether the patient has got all the information that they need for the surgery, whether they understand what they are doing, whether I have given them all the information. So like more of a patient-centered care and evidence-based practice is what I would think has changed in my own practice.
Okay, and then how do you compare the challenges for women's health in India and UK? Are they same or they are slightly different?
They're definitely different because in India the challenges are much more because ours is not like we have challenges in women health. So we have like in India there would be a challenge of access to health services, whether there's somebody to bring them to the hospital, whether the distance is the transport is a problem. All these problems are not here. But here there would be long waiting times in the A&E. They could contact the doctor as much as they can, but then when they go to see in accident emergency, in an emergency, they would have long waiting times. Of course, it would be prioritized clinically, but these would be the challenges. Also, you cannot buy over-the-counter medicines, anything that you want, as we could do in India. Even as a doctor, I cannot prescribe myself. So these are the challenges the
We have
woman
some
might face.
liberty and independence, kind of independence we enjoy in India.
Yeah, definitely. Agree.
So you have worked with tea plantation workers in Tamil Nadu. What unique women's health issues did you see there? And do you want to take it into global conversation as well?
So the Tamil Nadu tea plantation workers have the challenges are not only related to women's health and maternity or reproductive health. They are in general quite a bit like, I would say, if you see the ergonomics, the climate, the ergonomics would be like they have to work on hilly terrains, and they would carry a lot of burden on their head or shoulders of the tea leaves, and that would be like giving rise to musculoskeletal problems, which does affect the quality of life, the quality of care they would give to their children, or the quality of care they would sort of give themselves during pregnancy and childbirth. So solving these issues was like I had worked whatever I could on those aspects. Hilly terrains, and the climate would be, it would be raining 6 months in a year, and there would be leeches on the ground which would like make them anemic over a long period of time. So we had to devise ways where the leeches would be keeping off them. And then in the field, I used to get distributed iron tablets so that they don't fall anemic when they are pregnant, or even for their general health. So, and I have addressed a few in global sort of platforms. Like I did a audit on geriatric population in the tea plantation, and it was about how much healthcare they are seeking, whether when they are sick, do they actually, or they have problems, do they actually go and seek medical help or not? And it came out to be that they were not, most of them were not seeking help. And I had presented this in the RCOG as well, which was published on the journal which they publish for the Congress. However, after this, I used to send ambulance once every month for the geriatric population to come to the hospital to discuss their problems. So, I mean, this is just one example.
So challenging, I can understand from your words.
Yeah.
But in your opinion, how does this cultural context shape women's health priorities in different regions? Like you already explained about some of the things in India, but are these issues also there in UK? Some cultural.
So, I would say in the UK, the autonomy given to women is much more. And so they enjoy what you say, they take responsibility of their health, whereas this is not so much in India, also affected by the level of education.
Indian women are not into looking after their health. They are more into their family, their children, their husband maybe, but always neglecting their own health. So that is the main cultural difference, I think you're right.
Yeah, and once like the autonomy is given to them, they would look after themselves. And also culturally, if I see women looking after themselves here, and if you saw your mother or your grandmother looking after themselves, you would naturally like sort of think that you are something to be looked after, isn't it? So, so that is how like it is different, because here in India, women never think that they should look after themselves. They only try looking after the children and husband, as you said, and their families. I mean, this is a major cultural difference, and I believe that everyone should look after their health, because women being at the center of the family, like as a center of the family role, they are the most important to be looked after.
So, from your experience, can you just make us know what lessons actually India can learn from UK in terms of maternal and reproductive health care? I know about the National Health Services there, the government looking
Yeah.
after all the health issues of everyone. This is not here in India.
Yeah.
It's one thing I know. But
Yeah,
what lessons we can get from UK?
Yeah, there could be quite a few, but the most important thing I think is the training and updating of doctors. So here in the UK, every level, whether you're a consultant, a mature consultant, or you're going to retire, you have to participate and do updating every year on a training, a Teams learning, which is a simulation of obstetric emergencies. It's called the prompt and the CT training. It is mandatory for everyone. The teams that work together train together. It involves everyone, the consultants, registrars, SHOs, and the midwives, nurses, healthcare assistants, everyone. So that keeps us like very prepared for any emergencies, and each one knows their role. And I feel India should do this as a mandatory thing, because then it becomes like everyone is updated with what we do next, and it is very quick in an emergency to sort of save lives. So this is one of the things.
It's kind of mock drill, or maybe, as you said, updating of knowledge at every level. Like in India,
Yes.
when you become a consultant, we are hardly into training and updating our knowledge. But that is one thing we must learn, and another is working in a team, preparedness for emergency. I think midwives in our, or I can say nurses in our country, needs to be trained a lot.
Yeah.
That is one part which I think in my medical college is missing. So obviously we learn that from UK and UK Health Services.
Also, like it teaches you when you're simulating in a team, like we work in teams, and then it will be like
the teamwork.
It's not only about treating the patient, it is about leadership. Who takes the like leadership role, how you take it, communication between the
team.
team.
The role, job responsibilities, or the roles assigned to each and every one, that is often missing in our part.
Yeah, and there is here your roles are very clear, and anybody can take leadership. We flatten the hierarchy in emergency situation. The hierarchy is totally flattened. Anybody can take the leadership role.
That is so amazing.
Yeah, and all the midwives are so trained that sometimes they take the leadership role.
Yeah, they have to be.
Yeah,
Midwives, they are so much trained and so much experience. The experience matters a lot. So I think any experienced person can take the lead in case of emergencies. Yeah. So my next question is, how do organizations like RCOG or European Society of Gynec Endoscopy or ICO contribute to shaping women's health globally?
Now, RCOG is a very old and very important, very effective organization. It as you definitely know, it works a lot on.
Yeah, we know. We are still following RCOG guidelines. When we have to look into something new, we look into RCOG guidelines. The green
guidelines. It is about like the RCOG always have done policies and guidance for obstetric gynae cases all the time. And it is not simply devising a policy, but it is about collecting evidence to devise that policy. And this has an impact globally, because all over the world, I think there are many countries who still follow the RCOG guidelines.
Yes.
And it's also about training doctors, updating doctors, which is also a very important role that RCOG plays. Also, yeah, so I think these should be the main. It also sort of brings together the practitioners and the global health policies, a bridging gap between the practitioners and the health policies. So there is a lot to speak about RCOG, but
I
yeah.
know. But do you think the innovation from the UK could be adapted effectively for women? Are women in low resource setting? Because some of the guidelines we are not able to follow because of some limitations as we are low middle income country.
Yeah, of course. I mean, our countries are different, so it's not, we cannot adopt everything, but there are a few things which we can do which doesn't involve much of cost. Like I said, like training, updating of doctors, doing simulation practices. This doesn't cost us anything. Of course, it is done here on mannequins, but we can do without
Yeah, of
mannequins.
course,
We
that
can,
training part, I'm totally agree. That is one of the kind of quality improvement initiative. It doesn't need infrastructure. It is just
yeah.
about even reassigning your role, doing it, working in a teamwork. It's what is needed. So that
Yeah.
training and teamwork, quality improvement, we can always look forward to from them.
And also, we are constantly doing audits, research, and
Yeah, audit is
things.
another thing which we are not doing.
Quality improvement projects, which we constantly do. There is no CV which will be accepted without you doing an audit or a quality improvement project, or some teaching as well. So it is like it is so incorporated into the system that it constantly we are looking for improvement, and this can be done without any cost in India as well. So it just needs a little bit of effort from our side to do all this. And then, like here, the system is very transparent to the patient. Like they know exactly what we are doing, exactly what we have done, exactly what we saw. We even show them the pictures, and they have in many hospitals have a app like whatever software we are using has an app on the phone on their phone where we can send messages, appointments, everything, and even the notes that we write for them they can see them if we allow them to see. So it's a very transparent system. I don't say this would be very practical for India because many people
But many
might
of
not
the
have this.
corporate hospital are adopting this policy. May not be transparency, but the person looking into the patient, looking into their reports, their day-to-day appointments, those have come into corporate hospital, and even the government hospital are now much into taking
So this
this
could be it could be a wonderful point.
digitalization.
Yeah, wonderful thing to be adopted.
What inspired you to champion occupational health for women in plantations? And how can such grassroots efforts be scaled globally? Because I'm really inspired by your work done for them.
So if you go to the plantation tea workers, the 75 to 80% of the workforce there is women. So are women, and therefore, and they have like very poor access to health resources. They don't know anything because they are illiterate population. They don't know much about taking care of health and things like that. So that inspired me, and then I could see so many things which I could improve for them. And as the IMA president, local IMA president, I thought there could be like work done at least a state level for them to sort of get better health care. So, I mean, the conditions I saw, the existing conditions was the thing which inspired me to work for them, and improve things.
That is amazing and so wonderful. So now a little bit about your future directions. So if you have to outline global agenda for women's health, what are the top 3 priorities you would choose for women in UK and maybe for women in India? Or maybe for both of them globally?
Yeah, globally, I would say that I would want, first of all, as I said, the screening programs the screening programs are very important in prevention of morbid conditions. So I know that India has breast cancer as the leading cancer, closely followed by cervical cancer, if I'm not wrong.
Yes.
So if we bring the screening program, which is so prevalent here, so screening program it does have a cost, but it is not as costly as the burden of having the disease.
Yeah, that is true globally. Prevention is always better than cure.
Yeah, so the screening programs would be one of the agendas that I would like to do. And then, as I said, training, updating of doctors, working in teams together, inculcating leadership, team working, communication in the team is very, very important, because that saves lives.
Yeah, of course.
And the third thing I would like to do is, give me a minute, I had written it down. Be persistent in these efforts, basically, I would say.
Yeah,
Be
the
persistent
consistency. Yes, of course, when we start
Yeah.
a program, we are very
Consistency.
enthusiastic about it. But we
Yeah.
have to see it rolling and see the sustainability of the program also. That is
Yeah.
very, very important.
Yes, and also, like as I said, if we do audits, research, and things, many things will come out of it where we know where we need to improve. Once we do an audit, we know where the improvement is needed, and we can work on that. So should be an important part of improving healthcare.
Yes. So we didn't talk about your robotic and laparoscopic surgery skills. So how do you see technology changing the women's health over next decade? These technologies,
Yeah.
especially.
Yes. So when we were training, or soon after our training, I think we never learned laparoscopic surgery during, but then laparoscopic surgery was a big leap forward in patient care, in how the patient feels after surgery and things like that, even cosmetically. Now the robotic surgery is taking a momentum, is gaining a momentum. I'm only a robotic surgeon in the making. I'm going for certification only on the 20th of October in Turkey, but soon we'll be there. I think robotic surgery is another leap forward, in the sense that in future, I think it may be quite common to do surgeries with the help of AI and robots, sitting right in the comfort of your home. So working from home will become possible for us, I think.
That is a distant dream for us, especially for obstetricians.
I know.
One thing which is not going to be changed, maybe probably cesarean section.
Delivering babies.
Yeah.
Yeah, that we have to go there, but yeah.
But
The gynae surgeries could be possible.
Gynae surgery could be a distant dream to do from home. That is absolutely fantastic. We just look forward to it.
Yeah, so now, I always envy people who can work from home.
Yeah, that's true. Being a doctor is very difficult to do, especially being in the clinical field. I know many of the branches, like radiologists, they can do work from home, reporting from home.
Yeah.
Even pathologists can do, but for obstetricians, cesarean deliveries, absolutely a distant dream. And I think it won't ever be possible to do it from home. So lastly, I would just like, what advice would you give to young doctors in India aspiring to have a global career in women's health, or aspiring to go to UK, USA? What advice you have for younger generation?
Well, I would say to them that they should be hardworking and learn everything that they can. The hands-on is the best in India. So
yes,
hands-on.
Absolutely, I agree with you.
Yes. So I had the best of both worlds, hands-on in India and the theoretical learning. And I mean, some hands-on definitely.
And updating your knowledge, teamwork, leadership.
Yeah, those things.
Innovation you learn from.
Yeah. So I would say do as much hands-on in India as possible, because today I stand confident on my grounds because of the foundation I have laid in India. So anyways, and the second advice I would give them is to have a holistic approach to health, not only about like seeing patients, giving them medicines, doing surgeries, but they should have inculcated in
that is
leadership.
one tip I always give to my students. That always be holistic in your approach. Just seeing the patient, writing the prescription. Do tell them in advance what you're going to do, what is the future direction for them. So seeing the woman holistically is one thing which I am also passionate about.
Yeah, so they should also inculcate leadership, communication, teamwork. All these things should be inculcated during their medical training itself.
MBBS.
And if not, then they should make an extra effort to do all this, so that they become better doctors in the future. And also use patient-centered care. Like always think of the patient on what you're doing. So that is what I would think they would need. And also I would advise them to adapt to change always, because the world is changing. Our field is changing. The way we used to work is changing. So they will have to adapt to a lot of change, because changes are constant. And I would advise them to read 2 books, which is one is Our Iceberg is Melting, and the other one is Who Moved My Cheese. They are excellent books on change.
I'm also going to read these 2 books. Thank you, nice of you. So, being a quiz committee chair, I always end my podcast with some rapid fire questions. So we come to that round. So here are your rapid fire questions. You can answer in 1 word or 1 sentence or whatever you like. India or UK, where did you learn the toughest clinical lessons?
Toughest clinical lessons, I would say India, because India is where I sort of, my early days of being a doctor was in India. So the toughest lessons are always the early days.
What was the first thought when you stepped into NHS labor ward?
Oh, it was overwhelming, because I had never seen a labor ward like that. And here it was not a ward. It was like every patient had a room for themselves. The labor ward it's called a ward,
private ward, which we call in India.
Yeah, one room for every patient who's in labor. And then we had anesthetists 24/7. We had obstetricians, a whole team of obstetricians 24/7, midwives, all confident, all communicative, all like very caring for the patient. Each room had a computer, CTG machine, which they were on constantly on
that
constant
kind of
CTG monitoring.
Infrastructure is, of course, a distinct thing for India, especially for the common people. Maybe for high economic grade, we still have these facilities are there in some of the corporate hospitals. So one medical skill you mastered in India that helps you in UK as well?
Oh, there are many, but I would talk of my scanning skills, which I learned in India, the transvaginal ultrasound scanning, which has helped me to gain super specialization in early pregnancy, acute gynae, as well as it's a very useful skill to have. So so that is an important skill which I learned, but there are many others.
Yeah, but I wanted only one. Yeah. So if you could bring one UK women's health policy to India, what it would be?
Screening programs, because
screening for all the women.
Yeah, cervical cancer screening, which would be like doing the screening test, the cervical screening test. Here the policy is every 3 years for women up to 49, and then every 5 years till 65.
So have a different policy, like via every 5 years, being a low resource country.
Yeah. The burden of the disease would be much more than the burden of doing a screening program.
Of course. So vaginal delivery or C-section, which challenges you more as a doctor?
Okay, so in my early days, I was challenged by cesarean section, very early days. But as you know, the cesarean section is not as challenging as a vaginal delivery. Now, vaginal delivery in the UK is quite a challenging thing, because we are totally sort of, as long as we can avoid doing a cesarean section, we do that. So we also do a lot of instrumental deliveries, and then there could be like
medical legal issues.
Horrendous instrumental deliveries, which can be like very, very challenging if the if you're not sufficiently trained, or if there is like even a little bit of things which go wrong. So, and then there could be PPH, vaginal tears, third and fourth degree tears. So vaginal deliveries, instrumentals, I would say is more challenging than cesarean section. But of course, we have high BMIs, 51. The highest
obesity.
recorded in our hospital was 91. So, so like those would be challenging for cesarean sections.
Okay, so laparoscopy or robotic surgery, which do you enjoy more?
I do enjoy laparoscopic surgery, and robotic surgery I haven't reached a stage where I can enjoy because I am still in the making. So, but I'm sure I will enjoy it once, more than laparoscopy once I'm there.
Best wishes to you for that. Tea plantation clinic or NHS, which gave you more unforgettable stories?
The plantations, because they were quite challenging.
You shared some of them also.
Yeah.
The proudest award you have ever received? Maybe a rewarding thing from
no award has made me that proud as the love and respect of people when I started doing things for them. So that was an award in itself, the appreciation and love of people.
Your
I got plenty.
appreciation and feedback from patients, I think, is most rewarding for me as well.
Yeah.
Favorite comfort food after long duty hours?
Dal chawal.
In UK, I want to know that. What do you have actually?
Dal chawal.
Dal chawal you get in UK. That's wonderful.
Yeah. Yeah.
So the last question may be, if you weren't a doctor, a teacher, writer, or a social activities, or anything else?
So yeah, if I wasn't a doctor, I would definitely have chosen a field which has a lot of art because I'm always inspired by art. And our field is also definitely something which does include art in itself. So I used to do very good paintings in school, never did after medical college. Then I used to.
For me as well that you are a painter also.
I'm not a painter, but I used to paint on my own. I have never learned painting.
Yeah, but that is a question. We never knew that.
Yeah, I like doing interior decoration things. I used to write a few poems. So I would have been a writer or something to do with art.
You would be a very great writer as far as I know you. So thank you so much, Jyoti, for being here for my podcast. It was wonderful talking to you, and I hope all the viewers would definitely enjoy it. So have a wonderful Diwali. Good night. Bye for now.
Thank you, Archana. Thank you for the engaging conversations. I really enjoyed it. And thank you, Ms. Tandulwadkar. Very nice to meet you on screen.
Maybe you can meet her during AICOT. You would definitely meet her.
Yeah, sure.
Bye.
Okay, then. Thank you very much. Have a good day and happy Diwali.
Thank you.